Awesome. Thank you. Yeah, so my name is Grace Wilkowski, and I use she, her pronouns. I don't know most of the people in the room, so if you want to put in the chat who you are, where you work, or what brings you here, that would just help me know you guys better. I am going to show a bit of a presentation, which is like PowerPoint slides. Feel free to interrupt me. I want this to be more of a conversation while we work through this, but I recognize we all come from different backgrounds and different areas of the world and work in different areas. So just being able to kind of work together, figure out what we need tonight is all important to me. But with that, these are my PowerPoint slides. I made them. And let's get into it, shall we? So a bit about me. I received my Bachelor's of Science in Psychology and my Bachelor's of Arts in Human Development from Washington State University. I'm currently a Master's in Public Health candidate with Florida International University. During that time, I've worked for Washington State Healthcare Authority. I worked in their Division of Behavioral Health and Recovery and Substance Use Prevention and Mental Health Promotion. During that time, I worked within, obviously, the state level. I also worked within East Valley and West Valley, Spokane Valley. After that, I chose to work for Catholic Charities in their COVID-19 isolation center and had that direct one-on-one relationship with the homeless population. Currently, I am the coalition coordinator for Shadle Prevention and Wellness Coalition, which is focused on substance use prevention and mental health promotion. I'm also someone with lived experience within substance use in my own life and with those I love. So this conversation is just near and dear to my own heart. So what on earth is Shadle Prevention and Wellness Coalition? You've never heard of us before, and now I'm here to tell you things. So really our mission is to develop a culture that's drug-free and just a place that people want to be in. And for that, lowering the level of misuse of alcohol, tobacco, marijuana, and drugs by youth specifically. If you're over 21 and you're doing something legally, by all means do it in a safe manner. But this is really focused on that youth aspect. We received our funding in 2019 and started implementing our services in 2020. We are a community prevention and wellness initiative, which is, you'll hear me call it CPWI, but it's just a fancy way of saying we have grant funding from the government. It's these 3 grants you see here. The nuance of what those grants really are does not matter, but it's 3 grants put together and called this initiative. We also are a drug-free community recipient. We do that in collaboration with the West Spokane Wellness Partnership, which is our sister coalition. We also have 5 coalitions in total in Spokane County. So there's a couple of us out there. So prevention science, sorry, I know you guys can see the little black box and it's just like your guys' face. So if you see it moving around, I'm sorry. So prevention science, the basis of prevention and prevention science is to prevent injury prior to it occurring. For example, if you go to the doctor regularly, whether that's your dentist or the eye doctor, you're trying to prevent worsening. Like, for example, you go to the dentist, they find your cavity, they find it early enough, you just get a filling and you're good to go. If you waited long enough, you need a root canal, maybe surgery and all that stuff. We're trying to prevent that worse stuff from happening. Substance use prevention is the same basic principle, but it's around substance use. So preventing substance use before it starts. Looking at this is called the continuum of care. Often we hear treatment and recovery. Treatment would be treatment services, right? Like rehab, something like that. Recovery is someone who is currently sober. But we work in that blue area, and that's prevention science. Promotion, an example of promotion is that saying like, eat an apple a day and you'll keep the doctor away. It's just like truly a good habit. I could not tell you the rhyme or reason behind it besides it just being good to eat your vegetables. Universal, that's a little bit more specific. It would be like if we served a middle school, we gave out a flyer to every middle schooler at this certain middle school. It's more specific than eat an apple a day, but it's the only reason those people are getting services is solely because they just happen to be at school that day. Selective gets a little bit deeper with it, and that would be like if we had a conversation with every 7th grader in that same middle school. It's a little bit deeper, but again, those kids didn't do anything to be in 7th grade. They just solely showed up to school. Indicated is like if in that 7th grade class, a kid showed up and they had a vape on them and they were caught. Then if we provided services to prevent them from using that vape anymore, indicated something had occurred that then caused support to be needed. Is there any questions around that really quick? Cool, okay.
I have a quick question, Grace. Is there, I mean, obviously the approach is probably the wider you cast the net, the more, you're going to need all these different components at some point. Is there, some that are more effective than others? Like, to me, I tend to assume that the indicated one, if you can kind of, in a sense, lovingly call someone out and say, hey, I know this isn't a challenge for you, but I'm curious, what is your thought on that?
Yeah. So there's a healthy balance, right? There's a healthy balance to anything. An indicated program or a selective program, due to that one-on-one relationship that has to occur and maybe the buying of a curriculum, the salary of someone, it's inherently going to be more expensive to do a selective or indicated program effectively. However, there is more evidence and more research to show evidence-based indicated and selective programs to lower substance use. And I'll dive a little bit more into what research-based means a little bit later. Universal, though, works really great to just kind of reach everyone, right? So I think it depends on what you're hoping. I think a healthy balance is definitely it, but it depends. That one-on-one relationship, amazing, evidence-based. Universal works great. We're just genuinely in a high-risk community. Like, you work with a high-risk group, getting all of them, easy, done, universal. And then this one person still struggling, give them that indicated, right? Instead of every single person getting indicated. Did that answer your question? Cool. Perfect. So what is substance use disorder? For the purpose of this conversation, we're going to follow SAMHSA's definition. SAMHSA is a federal, I don't actually think it's a government agency now that I think about it, but it's a federal organization that is like known to be the experts in substance use prevention. And so this is the definition. It says substance use disorders occur when the recurrent use of alcohol and/or drugs causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, or home. I want to note this doesn't name the number of times someone uses, how often, what that use looks like, and so on and so forth. In other settings, that definition may be used. For today, we're not going to use that. And the rationale behind that is someone who maybe has used once or twice, but it affects them to this level, may have a use disorder and just hadn't really recognized that in themselves previously. So it's just, it kind of levels the playing field, and it's not like, oh, you haven't reached the quota, right? And then SUD or substance use disorder can both be the cause and consequence of homelessness. Those who work in shelters, I think kind of recognize that sometimes people began using, lost their home, or they lost their home, were stressed, began using, whatever. And of course, other things play into that as well. So here's some fast facts for you all. As of 2018, about 1,250 people were sleeping outside or in shelters in Spokane. This data point is the only one that is Spokane specific, and that's really important for me to point out. Spokane is different than these, but due to the population size that is homeless in Spokane, I can't receive data like the ones below without it being personally identifiable. I also recognize 2018 was pre-pandemic, so things have changed. Due to the pandemic, I can't have new data. but if I had it, I'd give it to you. So nationally, 38% of homeless people are alcohol dependent and 26% are dependent on other harmful chemicals. Alcohol is a drug, but often they are separated. So that's just something to note as well. 71% of missing, runaway, throwaway, or abducted children reported a substance use disorder. While studies vary, over 1/3 of people experiencing homelessness experience a drug and alcohol problem, and 2/3 have a lifetime history of an alcohol or drug disorder. This is just some background knowledge to know as we move forward.
Can I ask a quick question? What is the definition of a throwaway child?
That's a good question. I, on the last page, have where my sources are from for this data, and I can pull that up for you. I don't have it off the top of my head, but I will get it for you.
Okay, thank you.
Yep. That's a good question. So risk and predictive factors. Risk factors are something that increase your likelihood of a certain negative outcome. A protective factor is the exact opposite. They are something that decrease your likelihood of that same negative outcome. So for substance use, favorable attitudes, if everyone around you thinks it's okay to do drugs, you're more likely to use drugs. Laws and norms promoting substance use. A good example of a norm is 420. When we talk about 420, that promotes substance use inherently. Obviously, that's going to create higher levels of substance use on that day. And then having peers who use. If all you're surrounded around is substance use, you're more likely to use. Protective factors are family connectedness. If your family is super close, you're able to have those conversations and ask questions when you're curious. That's going to lower your chances of you using substances. Connection to extracurricular activities. This can be school-related or not, whether that's faith-based, athletics, your family owns a business and you help out there, whatever that is, those all kind of lower your substance use. And then resiliency within itself. If you have a hard situation come up and you know how to handle it, you're less likely to fall into negative coping habits. And there's more than just these 6 I have here. So family and substance use. Families can be both a risk and protective factor. ACEs, or adverse childhood experiences, increase one's risk of substance use. Parental use is also a risk. However, having strong family communication is a protective factor.
What are the examples of ACEs?
ACEs, so I think they just changed it to 10, but ACEs are divorced parents, having a loved one pass away, childhood abuse. There's, I can't remember them all, but there's 11. I'll pull them up for you after this and we can go into them more. But they are based in a theory that basically say, if you have over 5 ACEs, you're more likely to have all these issues come up. Personally, I have 6, so it's not the end of the world if you have more than 5. And ACEs, we can go into that. I love ACEs. I think they're very interesting research, so we can go into that. But yes, a lot of people within shelters are probably facing some of these ACEs. It includes like struggling financially, right? But then, also
is an ACE.
Oh,
so
yeah,
if you've experienced homelessness as a trauma, then it's adding to your score as far as whatnot. And the ACE is basically, from my understanding anyway, kind of assess how many traumatic events have you experienced in your life? Because the more traumatic events you've experienced, the more difficult it is for you to avoid those risky behaviors. You know, you're more likely to struggle with like heart disease and stress problems or other, more challenges because you've been through all these traumatic experiences. Anyway,
exactly.
Very cool.
It's so, and it's things like that always like kind of like make my nerd come out, because it's so interesting to be like, wow, that makes so much sense. But recently they added having discrimination against you become an ACE as well. And ACEs are under 18. And yeah, like you said, ACEs could be something that increases your chance of like physical disease, as well as if you're constantly in fight or flight, you're not going to gain coping mechanisms because you're just trying to survive. So you don't necessarily have the chance to thrive. So ACEs kind of perpetuate that. So we want to lower those. So when working with those who have drugs, the whole person who use drugs, you want to kind of use the whole person model, and this allows for just better care. Going back to ACEs, right? So if someone is using substances and you're trying to get them in recovery and get them to services, and they're like, I don't have a car, but you don't help them get a car, you're not necessarily helping them. We often think in silos, or like funding is siloed. So working with connections and partnerships to create a whole person model, whether that's they need childcare, they need food, they need a change of clothes, where are they washing their clothes when they have it? Just really trying to figure out that side of stuff. And that will really improve the whole family, right? If you're helping big brother, then it's less on the parents and less on the younger siblings or whatever. So using evidence-based practices also supports the family. Strengthening family program, guiding good choices, and mentoring programs. Also, nurse-family partnerships is an evidence-based program, as according to Washington State. So Jennifer, I got really excited when you said you did nurse-family partnership. And an evidence-based program has gone through 2 research studies and shown a decrease in substance use. I do want to note, often in research, they use urban, middle, white families. So it doesn't necessarily mean that it's shown research in minority populations, or those like honestly, who we're typically reaching for. They haven't necessarily been researched in that area. However, guiding good choices and strengthening families have been. And then mentoring programs like Big Brothers, Big Sisters has also been researched in more urban or low income areas. So they have shown that kind of decrease in more unique areas, but that's something to take into account when determining an evidence-based program. Most of these focus on working with parents on ways to discuss drug use in a healthy way, and working with kids to understand coping mechanisms, how to handle peer pressure, and items such as that. So yes. So trauma and substance use. As we were saying, ACEs, trauma. High levels of trauma increase one's risk of substance use and mental illness. With that being said, correlation does not equal causation. When we say someone is high risk, or if someone has over 5 ACEs, this is going to happen. Nothing is like that in the world. We're not going to write people off and say that because something has happened to them, they are destined for failure or destined for something to occur. They simply have a higher risk, and so we need to support them better. With that being said, adolescents who have experienced high levels of trauma have a higher correlation to substance use and mental illness later on. PTSD and substance use also have a high correlation as well. So, and really that goes back to that constant state of stress. If you're constantly in fight, flight, or free, you don't really get that chance to develop your executive functioning. And so if you never have the chance to stop and sit down and be like, how is my current action affecting my future self? How does right now affect tomorrow? And you're constantly just trying to survive, then of course you're going to kind of make risky decisions. You just want to take a moment and relax, right? And everyone around you is saying drugs make that happen. It's reasonable to see how those two relate to one another. So our goal in prevention is to help develop that as executive functioning through evidence-based programs and using that whole person model to take away levels of stress that may be from hunger, lack of sleep, not knowing how to get to school, can we get them a bus pass, that type of stuff, to help just allow people to be people, right? So supporting those with trauma, in Shadle, we use a trauma-informed care approach. This also includes Handle with Care. Handle with Care is implemented in all Spokane public schools. And what Handle with Care is if a police officer goes to a home and there's a child there, they document that and they call. There's a lot more steps in this, but they basically leave a note to handle so-and-so with care tomorrow. And if that kid comes to school, their basic needs are really put forward first. And it's not someone was there to handle this situation. It's more just make sure we're supporting this person more, being there if they need to talk, and giving them the space needed to process. So National Homeless Coalition has a trauma-informed care policy that it encourages people to implement, as well as programs. I encourage anyone to look that up. Using that whole person model we talked about, student assistance professionals are in all CPWI communities. They do that intervention and treatment sector for us while we do prevention. They're also boots on the ground in school. So they get to build that relationship and kind of work through those things with the youth that we may not do because we're in the community. And then prevention practices. The Athena Forum /EBP has every single Washington State approved evidence-based program. I really encourage everyone to look at this and see if there's some that apply to where you are. And then Good Samaritan Law. Before I go over this, I personally am not law enforcement. I'm not a lawyer. I do not study law, but I truly just believe this is a good law for anyone to know, especially if they're around people who use substances. The Good Samaritan Law basically states, if you are with someone and they proceed to overdose, if you call 911 and perform life-saving measures, if you are in possession of drugs, you will not be charged, as well as the person who is actively overdosing. If you have performed other acts, you may be charged, but really this prioritizes getting help for the person and saving a life. It's just something good to know. This is something that should be taught on colleges and all that stuff, because alcohol poisoning or anything like that, this applies. So really the goal, we want to prevent use before it starts through evidence-based programs. We want to keep people safe around others who use, and that's through medication lockboxes and safe disposal opportunities. We want to ensure those who are using are aware of their resources. So I suggest hanging up flyers or signs with local resources such as CAT or MAT or safe injection sites, where to dispose of your used items. Having Narcan available for those who use and those who work around people who use. When I was in Catholic Charities, there was Narcan there and we did save someone's life. And so just having that available was important. Trauma-informed care, like we talked about, just ensuring you're supporting the whole person instead of going in there and having stereotypes or assumptions within yourself. And how do we know prevention works? So some past successes. There was a policy change, I believe in 2020, where tobacco and nicotine products, the legal age was 18 in the United States, now it is 21. That's prevention. We are currently working to pass a no smoking, no vaping, no marijuana policy for all Spokane parks. The Healthy Use Survey is implemented every 2 years in schools, and it has showed a decrease in substance use in places that have CPWI. Any youth leadership where they're advocating for substance use is a win. We see that a lot with our SAPs. And a coalition within itself is a win. If your community is getting together and talking about that, that's a win. So ways you can join in and also do prevention. So contact us, talk to us, say, hey, I work so-and-so, it's in your area. How can we do prevention, or how can we advocate? How can we start this conversation? Implement an EBP at your place of work. You don't have to work with us if you want to do an evidence-based program. However, if you would like to talk that through, I'm happy to support you. and take a program through our coalition. Spokane Prevention has all of our coalitions on there. We have parenting programs, town halls, education nights. We do stuff like this. I love having conversations like this, so just reach out and talk to your own healthcare provider and ask about what they're doing to prevent abuse and addiction of prescription medications or anything like that. Whether that's limiting the amount of pills prescribed, if it's providing medication lockboxes, or simply having a conversation, that just shows that that's something that's important to their clients and that they should address that need. And I suggest everyone learns how to use Narcan and carries it like a first aid, like a typical first aid kit. Narcan, Governor Jay Inslee, I was calling government to Jay Inslee, and I was like, that's not the word. Governor Jay Inslee passed a standing order stating that anyone who lives in the state of Washington can go to the pharmacy and ask for Narcan, and they will be given it. With that being said, you'll probably have to pay, but there's basically a prescription written for everyone in the state of Washington, so it is there for you.
Can I ask a question about that?
Yeah.
Is it available literally at every pharmacy, or are there certain designated pharmacies? Do you know?
My understanding, you can ask any pharmacy. If they have it in stock, though, that's a different question, but they can order it.
Okay.
I know Partners with Families and Children has a grant, I believe, for Narcan. And so they might be someone to get in contact about that with Jennifer.
Okay, when you say they have a grant for it, do you mean to distribute it in the community, or?
Yeah, to distribute it cost-free if they're in their service area.
Oh, cool. All right, thank you.
Yeah, of course. So here's my sources. And here's how to get in contact with me. Now we can chit chat. Wow, this is weird lighting, guys.
It's the end of the day. That's awesome.
Right.
Grace, thank you. That was great. I do have a quick question, just, for the audience. I love the focus on youth. Obviously, habits tend to start young. That predisposition stuff starts young. Do you have any information or know if those similar evidence-based practices work on older people, on like a more like a 25 plus age group?
Yeah, so there is, like, I'm thinking sport is one of our programs that's specifically to be implemented in a school, so it wouldn't work, but there's several for like college age. There's one called Basics, which is like, it's a 2-time interview and it's for that young adult age. So yes, there's also some for like the workplace. And so those ones of course are for adults. And even if it's like, you're like, okay, I work with this person, but the whole program won't work. If you take bits and pieces, some is worth better than none. And a lot of developers, if you reach out to them and are like, hey, this is my situation, there's probably something they can do to support you as well.
Cool. Thank you.
I have a question. Can you talk a little bit more about the prevention programs? You were saying that you have like workshops or education nights or that kind of thing. Can you talk a little bit more about those?
Absolutely. So there is 5 coalitions, so we all do different work. There's mine that's in Shadewell. Then there is the West Spokane Wellness Partnership. There is the Northeast Support Team, which is Northeast Spokane. Then there's the East Valley Community Coalition, which is in East Spokane Valley. And then there is one that covers Cheney and Airway Heights. Each one of us does different programs, but personally, I implement sports with middle schoolers at Salk Middle School, and we're currently working to get that in the high school. We also implement sport at a local shelter. Since it is a one-time implementation, super easy to do with kids, and it's only an hour long. We also do Strengthening Families, which is 7 weeks long, virtual or in person. It was virtual during COVID. There's Guiding Your Choices that is done by West Spokane Wellness. East Valley Community Coalition does Too Good for Drugs, which is an in-school based program. There's Project Success, which happens in every single school within SAP. So those are really those programs. For town halls, we have at least one a month. And those can range on various topics, such as the vaping, how to have that conversation, to just understanding what a dab is, right? That's a different way to take marijuana that wasn't around a couple years ago. So what's that? What's kratom? So we'll kind of dive into that and have local experts. We also do a lot of trainings on like DEI. Sheetal, personally, our coalition is very, I almost said adamant. I was like, they're super interested in DEI and understanding the training around that and how to support that.
What's DEI?
Oh yes, diversity, equity, and inclusion.
Oh, at DEI. Okay.
I got you. And please call me out when I use acronyms. That just like, you know how you get in that brain wherever you work? Just let me know if I'm doing it. But for trainings like that, we hold at least one every 2 weeks. And we also do a lot of professional development offerings that include like clock hour for schools or stuff like that. So yeah.
That is really cool. Thank you. I had no idea that much was going on for prevention. That's great.
Of course. And Kirsten put in the chat, we have a fentanyl facts night coming up on May 24th. That will have Washington State College of Pharmacy. We also will have United States Attorneys General talking about how to help someone who is using fentanyl or overdosing without really touching them, since there is a bit of a fear with fentanyl kind of hurting people through contact. Fentanyl is a little bit of a scary drug. Any other questions?
Not so much.
Oh, I have a question. This might be kind of out of your wheelhouse. I'm not sure what I got myself into. But I had a question. If primary care providers were educated in some of like this information about like drug overuse, or you mentioned sometimes you could ask your care provider like what they're doing to help. I think you mentioned that in your presentation, but are healthcare providers like required to understand like if they're over prescribing medication? Are there like classes or like or do you know?
To my understanding, no, but that's not like, I'm currently in my public health. We did talk about prevention, but it wasn't like if you prescribe X amount, then you are perpetuating overdose. That's not to say that doesn't happen with doctors. I don't have that level of education, so I don't know.
Okay.
Currently, Sheetal, we're conducting focus groups with assorted professionals within that field, including veterinarians, dentists, veterinarians, because what I've recently learned is animal medication is the same as human medication. So if your cat gets insulin, it is the same as the insulin you put in your body. My cat has diabetes, which is why I pick that one every time. But so to answer your question, as far as I understand, no. However, we're currently conducting the research to know. And from there, we're going to hold an education night to kind of fill in those gaps. Kirsten, correct me on the specific number, but my understanding is a majority of people who end up addicted to prescription painkillers or opioids, it is due to a surgery of sorts, that then they just couldn't get off the meds.
That's correct. Do you want me to throw the gateway link in the chat? That's a great way. Yeah, let me do that for you.
Cool. Kirsten is my coworker. She mentored me, so it's fun having her here. Gateway is a film through CADCA, which is another federal nonprofit. It's actually a government agency, and it talks about opioid addiction, what that looks like, and how to get through it. In there, it does talk about a doctor who just did not really recognize those signs. So I think it also depends on where you're at, right? So yeah.
Well, and it sounds too like what you're saying is, a doctor could prescribe, for one person, the one pill is going to be addictive. For another
Exactly.
person, it could be a lot more pills. And so it almost seems like maybe teaching doctors, how to, like you said, recognize those signs of addiction, or, figure out ways to have the conversation of like, hey, I'm giving you, like, I remember when I got my wisdom teeth out, like, they were like, okay, we're giving you these meds, like, be careful. And I was like, okay.
Okay, I'm careful, but I don't know what addiction looks like in myself.
Right.
My partner, when he got his wisdom teeth out, he was prescribed opioids and he enjoyed the feeling. So we were like, okay, you're probably not someone who should have opioids then.
Right.
He recently broke his jaw, and when he went to the ER, they prescribed him opioids. And I was like, no. Do not give this kid opioids. Don't, because he has clearly an addictive tendency to it. So we handled that situation and disposed of them properly. So just knowing that about yourself as well, and whether your family history has that, is often important. And I think we as people are trying to trust our doctors to do stuff in our best interest. And I don't think doctors go out of their way to cause addiction, right? But sometimes if we don't think of addiction as occurring from something, like we're taught that this is going to be safe, which has happened in the opioid industry, then the repercussions are hard, right?
Yeah, it's a good point.
Pamela, did you have a question?
Well, my son recently had surgery. He broke his collarbone and got his hardware taken out. The orthopedics doctor prescribed him 60 hydrocodones.
Wow.
For a 14-year-old boy.
That's hard.
So I think the main thing that I put out is that I was worried because there is addiction in our family as well. I wasn't going to give him any unless he absolutely needed it. But there's other ways of getting pain relief before you go down that rabbit hole.
Exactly.
So that's really, the Take Back My Meds is a great avenue for folks that want to prevent the addiction, want to prevent the, that temptation in their own household, to prevent that from, getting completely out of hand.
Absolutely. And even if it's like, for example, my jaw, it was important we still had those meds in case he needed those. We locked them up so that way I couldn't get into them. His father couldn't get into them. Kirsten, if she came over to my house, couldn't just walk in my cabinet and find those. And it's not that I don't trust those people. It's just that you never know what's going to be triggering for someone or what's going to lead to that situation. So just locking them up, putting them in a lockbox, disposing of them through Take Back Your Meds is a great one. Or finding a permanent take back location in your area. And just, trying those other things before immediately going to prescription medications. Thank you for sharing.
What does a lockbox, like, how do you get back into the lockbox? I'm not familiar with that.
Yeah,
I wish I had one
good question
to show you. I wish I could have one to show you. Usually I do, but I'm at home. So usually I have one right next to me and I pull it up. It is smaller than this, more fat. I remember getting them when I was little, like.
Grace, I have one. Do you want me to pull it up?
Show it, Kirsten. So there's a couple different lock
sec.
boxes. These are the ones that we have for free. We also have lockbox pouches, and basically they can either have a key that you need or like a dial code. Some it's like a dial code and then you like turn it. They can come in a lot of different ways. Your local coalitions will give you one for free. Hi, Kirsten.
Don't mind my face. I was just mowing the lawn, but this is what a lockbox looks like. And it has this great combo at the top. And right now it's not set, so I can slide it open. And then, one sec, let me change the angle. It looks like this inside. And this one has like a tiny pouch. And then we usually stuff information in them. And then inside is instructions to change the code, but it's usually set at 000. So you just clip off this little guy and set your code. And then only the person whose medication is in there should know what the code is. So I'm the one that set the code in my house. So all my medications in a lockbox. So my fiance, not that he would get into it, but that or my small nephews, if they're coming over and playing in anywhere and getting into places that I don't know, they're all locked up so they can't accidentally get into things. And then, yeah, like Grace said, like if she just came over to my house, because they're properly locked up and stored in a safe place. So 10 out of 10 recommend them. They're awesome. And we have, I'll post the link in the chat, Grace, if you want, for the Google form if they want to request one.
Totally. That's awesome. And if you're like with an organization that wants them, just email me and I'll figure it out.
Thank you. And thank you for the visual too.
Of course. That's funny. She just had them on her.
Those lock boxes are so small. If somebody knows that you have opioid medications and they want them and they take the whole box, how easy would it be for them to break into it? I mean, I work with people who, you know,
yeah, it's a good question.
I was wondering the same thing.
That's when I first started working in prevention. That was one of my first questions. I was like, my brother is in recovery. What if he wanted to break in? Yeah. And they're pretty solid. I think I could drop it out of the second story window and it wouldn't break. But like with anything, if you tried your heart into it, you could probably get in. If you are in a situation where you don't feel like that measure is enough, I would suggest getting you can get little patches, or not patches, but pouches that lock. Getting one of those, putting it in a lockbox, and then hiding it in your house somewhere. Just taking those precautionary measures. Of course, nothing is foolproof. If they just took the whole box, then the whole thing is they're gonna have to figure out a way to get in.
But at least having a lockbox is a way to prevent, especially like children or teenagers who, you know that you're, so they're not going to be tempted to take their parents' medications or something like that.
Exactly. So it's a step. Obviously, there's faults in everything, but I think especially if you hide it well enough or take more precautions or put it in another lockbox. And I'm happy to troubleshoot with you too if you want, and we can figure it out together.
Well, and I think too, I think at least with the families that we've worked with that do have substance use challenges, sometimes it's just that one moment of hesitation. This is not going to be as easy for me as I thought it was going to be. And that's what it takes for them to kind of click in their mind. I actually don't want to do this. Yeah. And sometimes it's that moment. So it sounds like maybe these boxes force that moment. And in some cases you can push past it. And then in other moments, in other situations, you could force the issue and get it open, and that's your choice. But forcing those moments of thoughtfulness could be really helpful.
That's a great point.
Yeah, just allowing that executive functioning to dial in. Exactly. I know I always feel like this. I don't think this is where your executive functioning occurs the longer I think about it, but.
I didn't think about it until you said that. Now I'm really thinking about it.
I think it is, because it doesn't develop until you're 25, right?
That's where your executive functioning is.
I did bad in neuro, or the brain development aspects of class. Any other thoughts or questions?
I have another general question. Your stats about how prevalent substance use is in the homeless population. I guess that's the whole topic, I think. But if we're not funding these organizations that are helping, and if we're just driving and we see someone with a sign, what do you, or maybe Emma could talk on this too, but if you do want to support them in the moment, with water or food, I know some signs say money, what do you guys recommend like helping like day to day, like in those instances on the street, versus like enabling them to, you know, misuse.
Personally, I always think your safety comes first. If you see someone and you're like, wow, I don't feel completely safe in this situation, totally good. Don't go into a situation and try and be the hero if it doesn't seem like that's right. I am a strong believer in care packages instead of money, just because, yeah, $20 is great, but 3 pairs of socks, a new pair of underwear, and water bottles or reusable water bottle, some snacks or something that's kind of more substantial, to me seems more reasonable. Also, I know most shelters take donations, and donations are something that are really easy for those who are served by shelters to get. You just kind of ask, in my personal understanding.
Yeah.
Any other thoughts?
I would echo that. I think obviously, yeah, safety is important, but too, like, I remember I read this article once that was really convicting for me as somebody who works in the homeless service sector, which was basically they did scans of people's brains in MRIs viewing different pictures. And one of the pictures they would show is a homeless person, kind of a stereotypically homeless person. And in most people, they found that your brain at a certain point registers the picture of the homeless person as an object, not as a person. And so if you have not done intentional work to train your brain to look at someone on the side of the street and say, that's a human being with trauma, with joys, with a favorite color, like, then your brain just by default will over time start to see that person as non-human. And I'm generalizing the findings of that research. I'd have to go back and find the actual thing. But the thing that stuck with me was basically like, if you don't actively fight against it, your brain will start to just gloss over the people that you're seeing. And so personally for me, like the kind of the takeaway that I got from that article was, if you can, look people in the eye, acknowledge them as a human, because that's actually going to be more important than your, you know, the change you have in your car that you're trying to find last minute. Like, look them in the eyes. I sometimes roll down the window if I'm at like a really long light and I'm like, hi, I'm Emma. What's your name? And I just like have like, I don't give them anything. If I don't have food in my car, then I don't give them anything. And, you know, great. And how long have you been in Spokane? And, you know, just like engaging them like a human, I think gives a dignity. And I think dignity is what takes them to the resources that they actually need, more so than your loose change. So that's my proponent. That's always what I will advocate for. And then obviously care packages is a great option as well. And then, yeah, send your money to the organizations that are helping the people. Because I think there is something to be said about like, sometimes you just go to the corner, you need help, that's what you do. But I think there is so much help in Spokane available that I think a lot of people can search for it and find it if they look. And so there are these little things, and I'll send it out when I do the recap of this meeting. There is a Spokane resource guide. It's a single piece of paper. You can fold it up into like a little booklet. And I give those out as well. Just, you know, here's where you can find a hot meal, a hot shower. If you're a single person and you're looking for shelter, go here. You know, here's clothing here. And it's a great opportunity to really empower people in that situation, to take their future into their own hands and then give them the dignity and I think you could do it. You're tough. Clearly, you know, go team. That's my approach.
I love that. Thank you. And I have a question along those lines too. Since you're working in the homeless services,
Yeah.
how are you feeling about our current status, you know, with the eviction moratorium kind of up in the air and with the housing market the way it is it looking like it's getting worse to you? Is it looking like it's getting better?
It's a great question. So I can really only speak for my specific population. So Family Promise only serves families, so adults caring for children or who are pregnant. So within that sector, however, nationwide before the pandemic, homeless families were the fastest growing segment of people experiencing homelessness in our nation. So you were more likely to be part of a family unit experiencing homelessness than an individual, or what we would call a single. So it was already on the rise. And then COVID, the eviction moratorium, in my opinion, actually has done an incredible job of keeping people in their, like families in their homes for as long as possible. The loophole with the eviction moratorium, and the challenge for landlords too, is if you're like the big landlord corporation, you've got a lot of safety net. And so you can go, a certain amount of time without rent. But if you're like the mom and pop landlord with just a few places, you also are now kind of screwed over because you haven't been getting rent. You're not paying mortgage payments. You're not, And so what these mom and pop landlords are doing, and what we're seeing in Spokane, is they're selling. And that's a way that they can legally evict their tenants because they're selling the property. So they can actually evict their tenants. That does not apply, like that kind of eviction doesn't apply under the eviction moratorium. And so now all of a sudden, all these houses are coming onto the market. All these people are moving over from high population areas, buying houses. And now all of a sudden we have no affordable units. So at Family Promise in Spokane, we just had a pretty significant turnout, families moving into housing finally. But we had about 8 families. So 25 people who had the money, who had the time, who had the energy, who had the paperwork, who had it all. And they were just waiting for housing. So more than any other thing, the problem is not homelessness at this point. The problem is a lack of affordable housing. And so in my opinion, the problem is going to get worse because as soon as the eviction moratorium ends, there will be no legal requirement for landlords not to evict their tenants. And in some cases, I don't want to get landlords the bad end of the deal here. Like they've been struggling too in a lot of cases, but they just need a paying tenant. And how do you recover? I mean, we got a rental assistance request last week for $12,000. How do you come up with $12,000? Like that's,
yeah, I totally get it. I understand what you're saying.
So it's a brutal cycle. It's going to take a long time, in my opinion, for us to recover. I expect to see a huge wave of homeless families in the months to come. And that's really what Family Promise is preparing for, prepare for the worst, hope for the best. And so what we've been doing is we've been scouring. We have been pulling in prevention money for months. The hope is that we can prevent families from becoming homeless, because prevention of homelessness is one of those protective factors that Grace was talking about. Because if we can remove the possibility of a traumatic event, that's obviously going to serve everybody better. And so we actually are in the process of receiving almost $2 million in rental assistance, which we will then be able to issue.
Congratulations.
Thank you.
That's
We're very
amazing.
thankful.
Yeah, that is amazing.
Yeah. So hopefully that will be able to put a kind of a dent, or at least a pause on some of the challenges. But yeah, all hands on deck. It's going to be a community effort. And although it's really difficult, and I really have no understanding of kind of the tsunami that is coming, my hope is that COVID has really taught all of us as a community to realize that it could happen to anyone. I think that's a benefit from this whole experience that I did not anticipate, which is you could know someone that loses their job. Like, and that's what they were relying on, and they needed that. And they were educated, they had great work skills, and their job just wasn't essential. And homelessness can happen to so many who you don't think it could happen to.
Yeah, I mean, at least half of us are one paycheck away from not being able to pay our rent, right? I mean, it's that close for about half of us. So.
Yep, and it's crazy. So I'm hoping that even though, in my opinion, the housing situation is getting worse for those most at risk, our community's awareness is increased to a new level so that we can hopefully step in. You know, if you're stably housed, that's a blessing. How can you use that to benefit others? Can you give money? Can you volunteer? Can you, even the circumstances, I'm getting out of soapbox. I need to wrap this up here, but like, do you know somebody that's at risk of homelessness, doesn't have a car? Can you give them rides around town for a day? I cannot tell you how helpful that is. Like, can you provide them a meal once a week if they are homeless? Like, there are little things we can do to continue to offer dignity to each other, even if you are, at risk. And so I hope in the months to come, like, even if the need is higher, the community engagement is also higher. I could keep talking about this, but I won't.
Thank you. That's very encouraging. I appreciate that.
Thanks for asking, Jennifer. I think that's all of it, right? And I think, Grace, you would say that as well. Like, half of prevention is just being curious.
I was just going to echo what Jennifer said. That was such a hopeful note to end on, Emma. And that like gave me like goosebumps. I'm like, I love that. Like, we're trying to see COVID blessings, and yeah, that was awesome. I appreciated your soapbox.
Well, thank you. Grace, I want to hand it back over to you for any remaining questions. And then, it is 8:00. So Marnie, you want to wrap us up after that?
Yeah, if anyone has questions, I am happy to take them. Or if you want to chat offline like that, you just have some more private questions, just let me know. Also, if you know youth that are at risk of being homeless, there is the Anchor Initiative would be really great to reach out to.
Awesome. That's great. Thank you. Grace, it has been a pleasure. Marnie, why don't you wrap us up?
Yes, thank you everyone for your curiosity and just your willingness to engage in this discussion. As Emma said, it can be controversial, so I really appreciate everyone really leaning into this. And Grace, it was a pleasure to hear from you, and I learned so much. As a community health major myself, there were some things I knew and some things I didn't. So this was I was really proud with how this event went. So yeah, thank you everyone and have a good night.
Thanks, everybody.
Thank you. Bye. Yay.
That was so good.
That went really well. Everyone was happy.
I know, such positiveness.
I also really appreciated your soapbox, Emma. I was like, yes.
It was so good.
I get really, like, I didn't anticipate personally, this is a side note, I didn't personally anticipate ending up in the homeless service sector. I was like really gung-ho about foster care and adoption. And then I stumbled into this organization and realized that the crux of it all is family connectedness, is trauma, is the resolution of all this stuff, is resiliency. And I was just like, this is where I want to be. Like, this is like where it all intersects. And I think it's a really powerful place. And I think not a lot of people understand that. So it feels good to be part of something that really matters and can just say, bring it all in, whatever, we'll deal with it. Like,
yeah.
So anyway, Grace, thank you. So where we go from here is I'll save this, upload it to YouTube, send it out in an email to everybody that registered for the event saying like, hey, you missed it.
And also on Facebook, right? I think we're gonna.
Yes, I also post a link to it on Facebook probably Monday at this point because I'm really busy tomorrow.
That's how I am too, don't worry.
Great. But yeah, I think this was awesome. Thank you for being here. I think on the like more application side, our case management staff will be reaching out to you, or I talked with what's her name?
Sarah?
Yes.
Yeah, Sarah and I, like, that's because West Spokane and Shadle are like the same spot. So yeah, today I was like, oh, I'm doing this. She's like, oh, I talked with Emma. I was like, oh, yeah.
Yeah, Sarah's great. Sarah's talking about maybe doing the families, what is it? The sheltering safe families, family night.
Strengthening families.
That one.
Yeah.
For Family Promise. So it will be exciting to kind of get some of this work into the shelter.
Yeah.
And go from there.
Awesome. Yeah. And if you guys need anything at all, reach